Dr. Michaels, we talked about missing teeth and how they not necessarily always have to be replaced, as many dentists might be saying, even though sometimes they do have to be replaced. But the point is, let's talk a little bit about if they need to be replaced or want to be replaced. What are the options these days? What advancement has dentistry made in terms of like replacing those teeth? Tell us a little bit, shed some big picture light on it, if you don't mind.
Sure. We've got excellent new technologies nowadays, but let me give you the big picture. If someone has a missing tooth, they essentially have two options. Either replace the missing tooth with something that's permanent or something that's removable. There are a number of appliances that work very well that you take in and out, and they're designed to replace anything from single to multiple missing teeth. They work very well, and they're relatively inexpensive. If you want something that's permanent, then we're looking at either a bridge or these new implants. Implants are titanium roots that are placed in the jaw, and then you can attach one tooth or several teeth to them. And they're a proven technology. They've been around for over 20 years, and I've done thousands of them. They work incredibly well. Then there's this other thing that's called a bridge, where you use the adjacent teeth to cement a large porcelain-like crown into that area to replace the missing teeth, and that works very well also.
Okay.
What you want to do is look at the situation carefully and determine which is most appropriate for you and your circumstances.
Well, give us a little bit of an insight of when doing a bridge, which has been the golden standard for many, many years, and only because implants came out, I'm very sure they not became overnight totally outdated. But tell us when doing a bridge would just be kind of more or less the right thing, and when doing a bridge, a patient should perhaps shy away from and rather go for an implant. And again, just a general picture, since one cannot diagnose the individual situation with just a video like that.
If someone has a missing tooth, the decision as to whether you should make a bridge or place an implant is very simple. Understand that if you make a bridge, the adjacent teeth need to be reshaped to receive the bridge. So if the adjacent teeth would benefit from crowns or already have crowns on them, then a bridge is the preferred route. If the adjacent teeth are in excellent condition and it wouldn't be wise for many reasons to essentially drill on them, then an implant would be preferred. As far as performance is concerned, both work equally well. They both cost about the same. And so your decision as to whether you should use an implant or a bridge lies in that one basic piece of information, and that is, what is the condition of the adjacent teeth?
I see. Well, let me ask you another question here. So I can understand that if, you have those two teeth here and the one is missing, and if they're very healthy, you don't want to necessarily grind them down, because I remember my dad kind of scolding me when I was, cutting trees, little hearts in it and things like that. And he says, look, you're hurting that tree. The tree could have a shock and not survive. Either way, even if it survives, you're hurting it. Well, it seems to be like with a tooth. If you grind it down, you not necessarily, but you open the door for it to have a shock. It is a surgery, so that then it dies prematurely, and by doing so, the whole bridge would fail, just like bridges fail when one of the anchor points goes bad. Is that about what you're saying?
Yeah, Helmut, you're absolutely right. And your analogy about the tree is a good one. I'm going to use that in the future. Thanks. You don't want to treat a tooth unnecessarily ever. The restorations that we have nowadays are extremely predictable. Rarely do we create problems by working on teeth. However, I'm of the mindset, and most dentists are as well, that we really don't want to do any drilling on a tooth unless we absolutely have to. So if the adjacent teeth would not benefit from crowns, then you're better off with an implant. There is one more scenario, though. Implants do require surgery, and there are some situations where the bone density isn't appropriate, or perhaps you don't have enough bone, in which case you may not have the choice or option of an implant. These are things that need to be looked at very carefully, among other things, with your dentist.
Sure, and without going into it and talking about it, but there are also options to augment the bone. You can like literally cement a bone on the bone and make it thicker over time. We're not going to go into it, but that option does exist sometimes, right?
It does exist, and in critical situations it may be appropriate. However, that's a very extensive procedure that you would be well advised to avoid unless absolutely necessary.
Got it. Now, one more question about the bridges, though. Let me give you an example. When me and my wife, we on an average go together, we enter the bathrooms together at night to get ready for going to bed. Now, I have done my showering, my shaving, brushing teeth, and she's still brushing, I think, her first quadrant. So my point is, she's much more thorough than I. A person like me, is it true that I might have more problems with a bridge? Because a bridge, the teeth are melted together and you cannot floss in between, where with an implant you can, and thus you have to use, floss threaders, and basically it's a little more tedious. A guy like me would quite often say not tonight, and by doing so, would I expose myself to unnecessarily periodontal disease, which then would make the bridge failing years earlier than it actually would fail, true or not?
Yeah, true. Absolutely true. Yeah, you need to engage in a higher level of care if you use a bridge.
Okay. Which, of course, if you do, it's not a big deal, but if you don't, if you know you're on the slappy side like me, then I might slightly more lean towards an implant if necessarily, due to that fact, because I'm risking, due to not so good maintenance, that bridge to fail earlier.
Patient care is extremely critical, and there are techniques even for individuals who are less inclined to spend as much time as they should cleaning a bridge. So that would be a factor. However, I think it would be a very small factor.
Got it. On an average, do you have, since you have done that for a long time, and there's maybe other data out there too, not just in your office, but on an average, have you noticed we already got it that in terms of biting ability and everything, bridge implant relatively the same. What about under normal circumstances, the longevity of either one of them? Is there a difference in implants on that it lives longer versus a bridge overall, yes or no?
The new bridges that we have are laser fabricated and machined to such precision and such strength that I don't think there's any data that would support the fact that one restoration, the bridge or the implant, necessarily has more longevity over the other.
Well, wonderful.
Yeah. The implant and the bridges are both excellent choices, and longevity is essentially the same. Cost is essentially the same. Cleansability is very close to the same. So the decision as to use a bridge or an implant lies exclusively and almost entirely in the condition of the adjacent teeth as to whether you would be inclined to do some drilling on those teeth or not.
Thank you very much again. Absolutely wonderfully informative, and perhaps a little different than what one hears out there. Not a lot, not controversial necessarily, but definitely different and pleasingly different. Thank you very much.
Thank you.